The Nigerian health sector has shown adequate response to COVID-19, and in the process, many of its flaws, which many knew internally, were revealed to all externally. How do we ensure that the learnings from the impact of a global pandemic are factored in when it comes to policy formulation and implementation for the health interest of the average Nigerian citizen? What can be done to correct the subdued state of the Nigerian health sector? We have conversations with the Minister of State for Health, Senator Mamora, next on Rubbing Minds.
Yes, well, like you rightly said, you recall that the initial designation given to the coronavirus was novel. That is something new. Before it was pronounced global pandemic, now designated COVID-19. Now, we are integrating beyond the primary health care. Because when you look at the whole of the health system itself, we have a department here in the Federal Ministry of Health that is called Traditional, Complementary, and Alternative Medicine. So that tells you that we're not just looking at what we know in terms of the Western medicine and all that. And just a couple of weeks, some weeks back now, we had an engagement, a Zoom engagement, virtual engagement with the herbal and traditional practitioners, asking them we had an engagement wanting to know what they have, how we can look into it with a view to having our own homegrown remedy, particularly following from the COVID organics that we had from Madagascar. So it's not right to say that we don't have or we're not looking at our own remedies, because whether we like it or not, the reality still remains that the bulk of our people, particularly in the rural areas, they patronize the traditional mode of treatment. So we're looking at that. Yeah, it's not just the elite that tend to go out to seek Medicare. It's a function of, let's get it clear. When people talk about medical, tourism and all that, my own reaction is that, yes, some other people may be benefiting, some other countries may be benefiting from this, but we also benefited from this in times past. In the 60s, especially the late 50s and early 60s, people were coming in here too. History has it that a lot of members of the royal family from the UAE, what we know as UAE today, from Saudi and what, they were coming in here. It's a matter of, do you have what people want, or can you give them what they require in terms of their care? That is the issue fundamentally. Of course, again, you have to also look at what's the environment like. People want to go to hospital and feel as if they're in 5-star or 7-star hotel. They want to get the services, not just clinical services. They want to get diagnostic services, laboratory services that are efficient and real. They want to get all that. They want to get the care itself. It's not just providing those services, but with care as well. That is, the attitude of the personnel giving this is also important. So these are some of the areas that are critical that we also need to look. They want to look at it. They want to be in an environment that is even conducive for patient care. So it's so many things rolled into that. But unfortunately, COVID-19 is such that has overwhelmed the health systems of the global community. It doesn't matter whether it's in America, it's in the UK, it's in Africa. It's just that those health systems that were weak inherently, or hitherto now, those are the ones that will definitely be more affected. If you already have, it's like a child that is malnourished. Now, measles now coming upon that child. The child will just trip over. That's just the thing. It's the same thing with COVID-19. The health systems that were weak before, they now have a tendency of now being exposed completely and being more overwhelmed. So that's the situation that we found ourselves with the coming of COVID-19. But like I always say, in every seemingly bad situation, some good can come out of it. And some good is already coming out of our own COVID-19 experience, because we're beginning to build structures, we are beginning to revamp, using your word, the system that hitherto had been, comatose, so to speak. It just reminds me of Animal Farm by George Orwell. Yes. All animals are equal, but some are more equal. The truth is that if we continue to say that health is wealth, and we say we believe that you must be healthy to do any other thing, then it means that the health of the people should be given priority. And in so doing, it means also that it's not just about the infrastructure in the health sector that needs to be taken care of. The infrastructure has to be optimal. 2, the workers. It doesn't matter whether they are doctors, nurses, pharmacists, medical laboratories, scientists, name it. Because the healthcare or patient care is a team event. So all these people who work as health professionals, every one of them is important. So they need to be taken care of in terms of remunerations, in terms of accommodation, in terms of condition of service generally. So, and some of these things have been gradually, addressed. Whether it's an issue of a lack of PPEs or whatever, all these are now being addressed. They are now taking front burner in terms of attention. So, these are the things, and that's part of the good that's coming out of this experience. So we need to, pay attention to the welfare of all the members of that health care team in terms of everything, salaries, remunerations, opportunities, and what have you. Because these are the things that will motivate them to give their best in the circumstance. Now, of course, we have put in place now insurance scheme, for health workers, particularly those in the front line. Well, it has not been perfect, but then I think it's been fair. It's been fair enough. We're a little bit comfortable by the strike action that took place in a short while, but that has since been resolved, and we're moving on to. We just felt that that wasn't. We quite understand the circumstance and all that, but we just felt that we as those that professionals in the health sector whose primary duty is to save lives, and secondarily to reduce pain and discomfort to patients. That's the primary core, and we, as much as possible, must ensure that calling of being a caregiver, particularly as doctors, should always come first. But then this issues, and of course not entirely. You cannot say that this is something happening in Nigeria. It's happening even in some other countries, even in Africa and beyond. But we are saying that we've got over that now, and we are using that experience to guide us so that we can pay more attention to the demands which are legitimate of the health workers So these are some of the, and of course it's also important to say this. Oftentimes, a lot of things that happen in the health sector, they are not primarily a problem of the health sector. Take, for example, you go to a center that does not have water. It's not Ministry of Health that gives water. These are some of the things that should be taken for granted. And potable water provision goes a long way to reduce the disease burden. A lot of things, if people talk of cholera, talk of typhoid, these are one, right? You come from contaminated water. So if you have potable water that people have access to, you will reduce that burden. And of course, the other thing is we need to maximize what is available. Maybe a little over average. Yes, we can do better. That's the truth. We can do better, and we will do better.